In the name of Allah, the most gracious and most merciful. With you, Dr. Muhammad الحناوى, obstetrician and gynecologist consultant. I speak today about vaginitis. Vaginitis, it is a general term for disorders of the vagina caused by infection, inflammation, or change in normal vaginal flora. What is a vaginal discharge? It is a secretion from vagina. It may be this discharge a physiological or pathological. Also, pathological may be specific or non-specific. The specific pathological is infective or non-infective. We classify the infective according to the age to the prepubertal underage female, or pubertal underage female, or reproductive adult female, or postmenopausal adult female. We can classify also the infective specific pathological discharge according to the organisms. It is bacterial vaginosis, Candida albicans, Trichomonas vaginalis, aerobic vaginitis, and others like viral vaginitis. We can classify also the infective according to the site. It is vagina or the cervix, which is infected by gonorrhea, chlamydia, mycoplasma. We can also classify the pathological specific non-infective. Non-infective may be atrophic vaginitis due to decreased estrogen during prepubertal period, lactation, and mostly postmenopausal. Or allergic vaginitis when the allergy reaction due to irritation or chemical from soap, the feminine spray, perfume, and vaginal contraception like spermicide and suppository. Maybe mechanical vaginitis, foreign body present, foreign body or tampon or condoms. Or may be due to dermatosis, the pinworm, scabies, and lice. We can classify the also pathological non-specific vaginitis when exact cause can't be found. The pathophysiology of the vaginitis, the normal vaginal environment is characterized by a dynamic interrelationship between Lactobacillus acidophilus, which is bacteria present in normal flora, producing hydrogen peroxide, which is toxic to pathogens, bacteria, and keep pH vagina at 3.8 to 4.2. Also the presence of other endogenous flora, estrogen and glycogen. Vaginitis occurs when vaginal flora has been altered by introduction of a pathogen, organism, or change in the vaginal environment that allow pathogen to proliferate by taking antibiotic, increase sexual intercourse so much, and vaginal douches and stresses and hormones. What is a normal vaginal discharge? It is vary from period to period and according to the hormonal status of the women. The amount of it is 1 to 4 milli per day. The color is white or transparent. Also may be thick or thin, mostly odorless, pH from 4 to 4.5. Consists of mucoid endometrial secretion, lovely epithelial cells from cervix and vagina, normal vaginal flora, and vaginal transferate. It increases the normal vaginal discharge. It increases mid-cycle, during pregnancy, with oral contraceptive pills, and with sexual activity, with special diet and stresses. How can diagnose? Diagnose the infection, vaginitis, by symptoms. Can diagnose by discharge, itching, and pain. Discharge, we can look to the amount, minimal or large, timing before menses like candida, or during or after or immediately after the menses like trichomonas or bacterial vaginosis, or after sex is sexually transmitted disease. Consistency, thick or thin. Color, the white or gray or yellow, green. Odor is no odor or bad or foul like fish. Also the other symptom is itching, irritation, and the other symptom is the pain. Pain with urination is external dysuria, or pain with sex is dyspareunia. We can look to the signs by speculum examination and the BV, the sites of infection, the vulva, clitoris, labia, and maybe vestibule, or maybe pelvis. We look and see the redness and swelling. We can feel and tenderness. Multifocal rounded macular erythematous lesion seen in trichomonas vaginalis. In vaginosis, the vagina is normal epithelium. We can do an investigation, but stop 2-3 days before investigation, and stop treatment for vaginitis for 5 days. We can do wet mount preparation by vaginal discharge with 1 or 2 drops of saline, normal saline, with cover slip. We can see motile trichomonas and closed cells, epithelial cell, are rounded by coccobacilli في البكتيريال vaginosis, or fungal hyphae and increased polymorphonuclear cells in Monella, or rounded para-basal cells in aerobic vaginitis. We can do also potassium hydroxide test by put 1 drop of 10% potassium hydroxide with cover slip. We can see the hyphae and spores of candida. White test, like potassium hydroxide test, we can smell the fish odor in bacterial vaginosis. Also, we can do litmus paper test to measure the pH of the discharge, increase above 4 in bacterial vaginosis and trichomonas. Also in atrophic vaginitis. We can do culture from discharge. We can do biopsy from the lesion. What are the risk factors and prevention of vaginitis? Keep vagina clean and dry. No vaginal spray, no soap. Just rinse with water to clean yourself. Wash it from front to back and dry it from front to back. No vaginal douching, which cause irritation, hide or spread infection, and remove the healthy bacteria. Avoid irritant, tampon, pads. Avoid clothing that hold heat and moisture, like nylon, tight jeans, jean sports, panty without cotton bed. Use cotton underwear. Avoid bath or hot tube. Eating yogurt to get from infection. Condom are best for partner. Gynecological examination every year. Use pad instead of tampon. Treat diabetes. Good control, but don't eat high carbohydrate diet. Allow the air to reach your genital area by wear loose fitting cotton underwear or not wearing underwear at night. Don't use so much birth control methods, IUD, spermicide, or contraceptive pills. Don't use antibiotics so much. Don't use steroids so much. Not increase sexual activity so much. We can speak briefly in each type. The bacterial vaginosis, BV, it is decrease lactobacillus producing hydrogen peroxide, change in pH, allow proliferate of organisms that are normally present in vaginal flora as Gardnerella vaginalis, Mycoplasma hominis, and Mobilingus species, produce metabolic products such as amine, which release the fish foul odor, and also the vaginal pH increase, cause exfoliate of vaginal epithelium cell. Increase the bacterial vaginosis with use of IUD doses pregnancy. It does not cause dyspareunia. It is asymptomatic in third cases to 3/4 of cases, and the symptoms are foul smelling and greenish white discharge. It is not a sexually transmitted disease, and thus the sexual partner not to be treated. Increased risk of premature rupture of membrane, premature labor, abnormal pap smear, pelvic inflammatory disease, and endometritis. Candida, increased glycogen production, especially in pregnancy, or alteration by estrogen progesterone from oral contraceptive pills, lead to adherence of Candida to the vaginal epithelium and facilitate growth of yeast, which is found normally in flora by a small amount. Increase this Candida with use of oral contraceptive pills with diaphragm, IUD, spermicide, and in case of diabetes, cases of intercourse so much, oral sex, pregnancy, antibiotic, stress, and steroid. Complication of vulvovaginitis, Candida's vulvovaginitis, chorioamnitis in pregnancy, vulvar vestibule syndrome. Symptoms, 50% it is asymptomatic, but symptom is very itching, severe itching, thick white discharge, cottage cheese. Recurrent vulvovaginal infection when 4 times occur at 1 year. The recurrence causes, it is not clear, but may be secondary to the predisposing factor, precipitating factor, sexual transmission, intestinal reservoir, vaginal persistence. Also trichomonas, it is a protozoan, motile organism with 4 flagellae, symptom from 20 to 50% asymptomatic, but when symptom occur, it is a heavy greenish yellow, frothy, bad odor. The partner is infected, the male partner, from 20 to 80% infected. It may be no symptom. Increase with use of IUD, cigarette smoker, multiple sexual partner. Complication, premature rupture of membrane and premature labor. Sexual partner should be treated, and it is a sexually transmitted disease. AV, it is aerobic vaginitis. It is discovered at 2002. Vaginal infection caused by disruption of decreased lactobacilli and increased amount of aerobic bacteria, Streptococcus, Peptococcus, Staph aureus, and others, especially during pregnancy, especially في third trimester. Cause yellow to green discharge that are thick and mucoid and with a rotten odor. The red edematous, small erosion on the vagina with dyspareunia. Complication, premature labor, and neonatal sepsis, maternal sepsis, increased puerperal sepsis. Treatment, also diagnosis before delivery by topical steroid, antibiotic local, clindamycin or systemic augmentin, or vaginal rinsing with bovidine iodide. Also, viral vaginitis can caused by herpes simplex and human papillomavirus through sex. Soreness or warts on genitalia can be found. Atrophic vaginitis, it is inflammation of the vagina, discharge and irritation and pain caused, and vaginal dryness caused by decreased estrogen prepubertal during lactation, mostly after postmenopausal period. Treatment, not respond to infection treatment, but respond to estrogen replacement therapy. The non-specific vaginitis, exact cause can't be found. Treatment of this infection by your doctor. Thank you.